Welcome to AR-I, Assisted Reproduction International. In this video, we will explain the fertility treatment options that are available in Assisted Reproduction Technology. If you have not watched our video on infertility, then you should do that first. Let's take a look at the fertility treatment options that are available. There is a succession of possible treatments that specialists will evaluate according to your medical history and current assessment. These are cycle monitoring with natural sex, ovarian stimulation with cycle monitoring and natural sex, intrauterine insemination, IUI, with a natural cycle or stimulation, in vitro fertilization, with intracytoplasm sperm injection, ICSI, with intracytoplasmic morphologically selected sperm injection, IMSI, plus intracytoplasm sperm injection, ICSI, or intracytoplasmic morphologically selected sperm injection, IMSI, with blastocysts, with egg, embryo, or sperm donation. Surrogacy. As most of our patients have undergone the basic treatment options in their respective countries, we will mainly focus on the most important assisted reproduction technology, in vitro fertilization. In vitro fertilization, or IVF, is a process by which an egg is fertilized by a sperm outside the body. There are two very important factors in this process, the egg and the sperm. You need good eggs and sperm to increase your chances of becoming pregnant. As you know from our video on infertility, the number of eggs a woman has in her lifetime is predetermined and limited, decreasing in quantity and quality over time. For all the eggs a woman begins with, in the end, only about 400 will go through ovulation. Unlike a woman, men have an endless production capacity, but sperm can also decrease in quantity and quality over time. In the natural cycle of a woman, only several dozen follicles are called into action. Then, a single mature egg usually gets the tap on the shoulder and begins its travels to the uterus for a date with a single sperm out of millions. As for the maturing eggs that didn't make the grade, there is no second chance. In order to obtain more eggs and increase your chance of getting pregnant, a specialist will prescribe fertility medication for a woman to stimulate the follicle development of the ovary. Once enough follicles are produced, they are collected by a procedure called transvaginal ovum retrieval, or OCR. During this process, a small needle is inserted through the back of the vagina and guided via ultrasound into the ovarian follicles to collect the fluid that contains the eggs. Now, we have our eggs and our sperm. What happens next? In a classical IVF procedure, the egg or eggs go on a date with freshly washed and groomed sperm in a dish, enabling the natural selection cycle. A single sperm penetrates the egg to fertilize it and becomes the winner out of millions. An IVF procedure with an intracytoplasmic sperm injection, or ICSI, bypasses the natural selection cycle because a single sperm is injected directly into an egg. Another IVF procedure, called IMSI, intracytoplasmic morphologically selected sperm injection, is a laboratory technique that involves inserting sperm into the egg that is morphologically selected. This is done using a microscope that is able to provide a much greater magnifying power in order to see the internal morphology of sperm and discard those with abnormalities. Being able to select sperm without morphological alterations is believed to increase the chances of successful implantation of pre-embryo and decrease the likelihood of miscarriage. The use of blastocysts in vitro fertilization, IVF, involves culturing a fertilized egg for 5 days before implanting it into the uterus. This process gives our specialists the chance to monitor the development of the embryos and identify any complications early on. Embryos that survive that long will be strong enough to increase the chance of a pregnancy and decrease the chance of miscarriage. Embryo transfer is the next step in the process, whereby one or several embryos are placed into the uterus of the female with the intent to establish a pregnancy. This is either done on the second or third day after an IVF procedure, or at 5 to 6 days after a Blastocysts procedure. Once the embryo transfer is complete, it is all in the hands of nature. As you now can see, infertility has its causes and can be treated successfully. Let us help you. After reviewing your medical history and your current physical state, our specialists will advise you on a treatment option that is best for you. These treatment options will increase your chances of becoming pregnant. Assisted Reproduction International is at your service. For more information, visit our site at AR-I.COM.